the quality of the life is deteriorated. People are experiencing a lot of stress, unhealthy lifestyle. The diet is the most important thing. Lack of exercise and obesity. All these things are contributing.
Does stress affect?
A lot. Stress, mobile is one of the most important factors. See, आपने कभी टेस्ट मैच में क्रिकेटर्स को मोबाइल पे बात करते देखा है?
Never.
5 दिन तक वो खेलते हैं, सुबह 9 बजे से शाम को 5 बजे. They don't use their phone, you know. फूड नहीं रहे, सर्कुलेशन में नहीं आ रहे हैं प्रेगनेंसी के. अब sanitary pads which you can use, change them every 6 to 8. The menstrual blood should be clot free. It's a liquid blood. So the breast cancer runs in family. If anybody in your family has a history of breast cancer, especially on the maternal side, you should always talk to doctor. भगवान ने किसी को भी दर्द देके नहीं पैदा किया, किसी को दर्द नहीं दिया उसने.
Hello sir, how are you?
All well, Chhaya.
Thank you so much for joining us.
I know it's a pleasure for me to be with you. I can understand it's a very special program you are conducting in the social media. And I'm very happy to be a part of this program.
Thank you so much, sir. My pleasure. बहुत टाइम से हम कोशिश कर रहे थे कि बस आप फ्री हो और हम फटाफट से इसको कवर अप कर पाए. I'm very excited because मैंने मेरे Instagram पे भी एक पोल क्रिएट करा था कि I'm going to talk to a male gynecologist. So if you have any questions, you can come up with your questions here. तो मेरे पास मेरी audience के भी बहुत सारे questions और मेरे भी बहुत सारे सवाल है. So I'm super excited. So yeah, let's start with the starting.
Sure.
Sir, why gynecology? Like, why did you choose this field? Like, कोई story थी इसके पीछे या फिर you were always interested into gynecology?
There can be many reasons for many gynecologists like me, those who are practicing. But for me, frankly speaking, see, it depends upon what kind of rank you are getting, and then with this rank, what are the various specialty you are getting. So during my entrance exam time, I was getting surgical branches, gynecological branches, so and other various branches, but I was relatively comfortable with the gynaec. There were reasons that you can settle relatively fast because there were not much super specialty in this branch previously. Nowadays we have many, and this was a difficult subject during my graduation time, but luckily I was taught by a good teachers in my college. I belong to Grand Medical College, which is in Mumbai, which is one of the oldest college of India. So they have taught me, very nicely about this subject. So I was comfortable in taking this subject. So I choose this one.
Wonderful.
My father, definitely, the way you were asking, my father said, why are you taking this branch? And it will be a difficult thing for you to. I said, like, man, somehow I like this branch.
Then how did you convince him? Like,
it was easy. I said, क्या फर्क पड़ता है? I mean, already बहुत सारे होते हैं डॉक्टर होते हैं, उससे क्या फर्क पड़ता है वो मेल है या फीमेल है?
जेंडर से क्या ही फर्क पड़ता है? जब हम दूसरे डॉक्टर्स के पास जाते हैं तो वी डू नॉट सी कि ये मेल है या फीमेल. तो गायनेकोलॉजिस्ट के पास में व्हाई डू वी सी द जेंडर की मेल है फीमेल? ऑफ कोर्स वो थोड़ा सा कहीं ना कहीं कंफर्टेबिलिटी का फैक्टर होता है, बट आई बिलीव आजकल तो पीपल आर इनफ एजुकेटेड कि they can talk about things to their gynec the same way they talk to their female gynec.
Nowadays, since I'm in Jaipur since last 2013, I've never, few patients react in such a way. Otherwise, most of them are comfortable. They come, they talk to us in a very good manner, and we really discuss their problems and give them a good solution. So yes, as a gynec, I can say, we are not the first choice of most of the female patient, but it is not like that. Once they have visited us and they were comfortable, the gender doesn't matter.
Yeah. That's wonderful. And I believe कि टाइम के साथ साथ ये चीजें भी बहुत ज्यादा सॉर्ट होती रहती है क्योंकि लोगों का पर्सपेक्टिव ब्रॉड होने लगा है कि it doesn't matter. या ट्रीटमेंट होता है, वो आपका कोई भी करे. Yeah. That's wonderful, and I can definitely see it's been 14 to 15 years in this field, so you're very happy, and I must say कि आपके patients भी बहुत ज़्यादा happy होंगे.
Hopefully,
with such a cheerful and happy doctor. Okay, so sir, let's start with the starting. जो हम periods.
Yes.
Yeah, ऐसा होता था कि like पहले के ज़माने में ऐसा कहते थे कि periods बहुत late आते थे. My mom got her periods when she was 18, 19. I got my periods when I was 11 or 12. I've seen my neighborhood, वहाँ पे एक छोटी सी बच्ची है, she got her periods when she was 9. So हमारी lifestyle चेंजेस जो होते जा रहे हैं उससे हमारी मेंस्ट्रुअल साइकिल पर क्या क्या फर्क पड़ता है, क्योंकि जैसे एज का नंबर कम होते जा रहा है, व्हाट इज द रीजन बिहाइंड इट?
Chhaya, it's a very good question you have started with this. Age is definitely, in broader term, if I'll say, age is increasing because people are living longer comparatively, because the medical facilities are better. One, but the quality of the life is deteriorated. People are experiencing a lot of stress, um, unhealthy lifestyle. Obesity is one of the major cause, diet pattern, oxidative stress, and everything is changing. In fact, you are talking to me in the prospect of female patients about the menstrual cycle, the beginning of menstrual. You see globally, मौसम बिल्कुल चेंज हो गए हैं. गर्मियां और ज़्यादा आने लेट तक रहने लगी हैं, बारिशें और लेट आने लगी हैं, सर्दियां भी लेट आने लगी हैं. सो ग्लोबली सब चेंज हो रहा है. As far as this question is concerned, एज किस एज पे आते थे, तो ideal age is up to 13 to 14 maximum. Usually most of the women gets their first menses. Nowadays 11 to 13 is the range, but 9 years is something very early, because once the women, a girl can start their menses, उसका growth, bone growth रुक जाता है, उसका stature छोटा रह जाता है. मेंसेस आना कोई गलत बात नहीं है, मेंसेस आना चाहिए, टाइम से आना चाहिए, बट उस मेंसेस के आने तक उसका बॉडी मैच्योर हो जाना चाहिए, उसका बॉडी तैयार हो जाना चाहिए, टू मेंटल स्टेट इतना अच्छा हो जाना चाहिए, सो दैट शी कैन टेक केयर ऑफ हरसेल्फ. सो ऑल दिस थिंग, दिस इज एट द एज ऑफ 9 year, वी कॉल इट एज premature puberty. So there are various causes, and she should consult to a doctor that why she is getting menses at the age of 9. But ideal is between 11 to 13 is a perfect time.
Okay, so majorly it's because of our lifestyle changes and the hormonal changes a girl
Hormonal
experiences.
changes is the major one. Lifestyle is one of the factor, but still 9 is too early. 9 is too early.
9 is too early.
Yes.
I was surprised when I've seen that.
Yeah.
But yeah, her parents must have consulted a doctor.
Yeah.
Yeah. The second most interesting question I have, that PCOD and PCOS, these are very fancy terms these days. Everybody's aware of only the terms, not the details, not the causes, and not the precautions. I want to ask कि पीसीओडी और पीसीओएस इतना बढ़ता क्यों जा रहा है? क्योंकि पहले 10 में से 2 लोगों को होता था, अब 10 में से अगर आप देखोगे तो 5-6 लोगों को तो होगा ही होगा. बी कि ऐसे हम क्या प्रिकॉशंस ले सकते हैं, हम ऐसे क्या लाइफस्टाइल चेंजेस कर सकते हैं जिनकी वजह से हम पीसीओडी और पीसीओएस से बच सकते हैं?
Very nice. See, PCO, let me tell you about this. Polycystic ovary. The way it's something related with ovary, which is a very important hormonal organ in a woman. It's the organ which makes a woman like a woman. So, in the counterpart, male has testes and the woman has an ovary. Now, every month they produce egg, which is to be released. But when women is not able to release the egg, then there will be a lot of egg in the ovary itself. This is what we call as polycystic ovaries. These cysts are nothing cysts. They are growing eggs, which are not, फूट नहीं रहे, सर्कुलेशन में नहीं आ रहे हैं प्रेगनेंसी के लिए. अब वो अंडे फूट क्यों नहीं रहे हैं, ये हमें समझने की जरूरत है. वहाँ पे बहुत सारे कॉजेज होते हैं. Something related with your brain hormones, something related with your thyroid hormones, something related with your other hormones, diseases like prolactin, thyroid, diabetes, obesity, chronic diseases. There are multiple causes which can lead their manifestation as a polycystic ovary. But when these are not there and still a woman is developing polycystic ovary, along with what we say एंड्रोजेनिक फीचर्स, मतलब बाल आ जाना, मूछें आ जाना, चेहरे पे बाल आ जाना, कुछ मेल पैटर्न उसके अंदर आ जाना. सो ओबेसिटी विद मेल पैटर्न हार्मोन, मेल पैटर्न डिस्ट्रीब्यूशन ऑफ hairs, and ultrasound which is showing a polycystic ovary is called as polycystic disease. Polycystic syndrome is they develop diabetes, they develop later on infertility, many other metabolic disorders. सो एक स्पेक्ट्रम होता है इस नाम का कि पॉलीसिस्टिक ओवरी है, आपको बाद में इस तरीके की मेटाबॉलिक डिसऑर्डर्स हो सकते हैं, लिपिड की प्रोफाइल, कोलेस्ट्रॉल गड़बड़ हो सकता है, शुगर हो सकता है, कैंसर के लिए प्रोन हो सकते हैं। इसको हम कहते हैं पॉलीसिस्टिक ओवरियन सिंड्रोम। सो मेडिकली ये सब चीजें, यंग गर्ल जिसको पीरियड नहीं आ रहे, अल्ट्रासाउंड कराते हैं, पॉलीसिस्टिक ओवरी देखती है, दे से क्या ना हैव अ पीसीओडी। नाउ कॉजेस, definitely diet is the most important thing. Lack of exercise and obesity, all these things are contributing.
Does stress affect?
A lot. Stress is affecting everyone, to a male and to a female as well. Male is getting in the form of low sperm count, lack of sexual performances, various other pattern, and women is getting menstrual abnormalities, polycystic ovarian disease, depression, uneasiness, irritability. All these things are related with stress.
So, compile करके देखे तो our lifestyle changes and mental health affects all of these things a lot.
हमें याद ही नहीं है छाया कि हम कब दिल खोल के हंसे हैं। नहीं? Yeah. You should smile, you should laugh from your heart. ऐसा बहुत कम होता है। हमारे दिमाग में हमेशा कुछ ना कुछ चल रहा होता है और हम वो चीज करते ही नहीं जो हमारे को एक बार में करना है। हम पता नहीं, मतलब आई बिलीव कि हम सब शायद उसी भीड़ के पीछे भाग रहे हैं जहाँ हर कोई भाग रहा है. वी आर नॉट चूजिंग आवर ओन हैप्पीनेस. वी आर डूइंग एवरीथिंग फॉर द सेक ऑफ मनी, फॉर द सेक ऑफ गेटिंग सेटल्ड, फॉर द सेक ऑफ पेइंग आवर बिल्स, for the sake of giving our children a better life, for the sake of giving our parents a better life. हमारी सारी इच्छाएं पूरी करना. तो इन सब चीजों के पीछे हम भाग के खुद को भूल रहे हैं. And which is creating a lot of fuss, because पहले ऐसे देखा जाता था कि डिप्रेशन, एंजाइटी का काउंट कितना कम था. ये टर्म्स इतनी फेमस थी नहीं, किसी को पता ही नहीं होता था, बिकॉज लोग बहुत अच्छे से रहते थे, खुद में रहते थे, फैमिली में रहते थे. मोबाइल इज वन ऑफ द मोस्ट इम्पोर्टेंट फैक्टर. इट इज. हम आपस में बैठे हुए हैं, फिर भी हम मोबाइल पे बैठे हुए हैं. So we have lost human touch. We have lost. We are not hugging each other. We are not celebrating with each other. We're just wishing them on the phone. And plus हम देख रहे हैं कि हमें बाकी लोगों ने कितना विश किया. That's important.
Of course, time के साथ चीजें बदल गई है, but there is always a way to take care of yourself.
Yes. You limit yourself.
Yeah.
I will work on phone till this time. Then I will spend time with my family. I will do this creative work. I will do. See, आपने कभी टेस्ट मैच में क्रिकेटर्स को मोबाइल पे बात करते हुए देखा है?
Never.
5 दिन तक वो खेलते हैं, सुबह 9 बजे से शाम को 5 बजे. They don't use their phone.
Yeah, so there is always a way to, choose your own happiness and choose your health first of all. So as we have discussed about menses, so like I also have this question personally कि women और girls को out of like market में बहुत ज़्यादा चीज़ें available हैं which we can use during our menses, जैसे pads हैं, menstrual cups हैं, tampons हैं और period panties हैं. So out of all of these, what would you suggest कि हमारे लिए सबसे ज़्यादा healthy option क्या है?
See, healthy option is sanitary pads which you can use. Change them every 6 to 8 hours, and if it is getting soaked early, change it as frequently as possible. A wet pad नहीं होना चाहिए unless until you have a concern that pad is visible. Then you can consider, if you're sexually active, using a menstrual cup. See, cup is something which you should use very carefully, not as a routine, I would say. Yes, it is in the fashion. Everybody is using, most of the girls are using cup nowadays. Yes.
Yeah.
But they need to be very careful about this so that they cannot introduce any infection. Okay. You should not put anything inside it. Whatever it is coming, it's a natural flow. Just take it on the pad, throw it.
Okay, so pad is the safest option.
Sanitary pads is the safest option. In fact, government of India is running many programs. They are distributing pads like anything, and all these are sterile pads. See, the cost added because of the sterility. Matlab, you have to make them completely bacteria free, infection free. So it is very good to be used.
Yeah, it's a good initiative. Also, like during periods, a lot of people faces cramps. So taking pills for the period cramps is healthy or not?
Pills in the sense antispasmodic pills, if she needs to take. Some uneasiness I can accept on second day or maybe first day, but she should not be suffering with cramps in the abdomen. If it is so, this is what we call as dysmenorrhea, painful menses. ये एक बीमारी है. एक इसका कारण ढूंढने की जरूरत है. क्या बच्चेदानी में इन्फेक्शन है, क्या बच्चेदानी में स्वेलिंग है, क्या बच्चेदानी का आउटफ्लो ट्रैक्ट ठीक नहीं है, क्या उसको ब्लीडिंग ज्यादा हो रही है जिसकी वजह से वो क्लॉट पास कर रही है, वो क्लॉट क्रैम्प की फॉर्म में बाहर आ रहे हैं. द मेंस्ट्रुअल ब्लड शुड नॉट बी हैविंग क्लॉट्स. द मेंस्ट्रुअल ब्लड शुड बी क्लॉट फ्री. इट्स अ लिक्विड ब्लड. सो यदि उनको क्लॉट्स आ रहे हैं तो हम पूछते हैं आपका किस साइज का क्लॉट आ रहा है. मोती के साइज का है, सिक्के के साइज का है. ज्यादा बड़े क्लॉट्स रहते हैं उनको पेन होता है. इसी को हम कहते हैं हेवी मेंसेस. उसका कारण हम ढूंढने की कोशिश करते हैं. ज्यादातर टाइम पर ये इन्फेक्शंस होते हैं जिसको उनको हो जाता है. हम पेल्विक इन्फ्लेमेटरी डिजीज कहते हैं और हम उनको समझाने की बहुत कोशिश करते हैं कि आप कैसे कैसे इस तरीके के इन्फेक्शन से बच सकते हैं. बहुत माइल्ड डिस्कम्फर्ट इज एक्सेप्टेबल, but severe, which is really affecting her life, day-to-day activity, if she needs to take pills, better एक डॉक्टर से मिलना ताकि वो उनको गाइड कर सकें कि मैम आपको क्या प्रॉब्लम है.
And we use hot water bags as well during period cramps. वो healthy है या नहीं?
वो hot water bag का कोई प्रॉब्लम नहीं है. Hot water bag will give you comfort. बट आपको पैड यूज करने का जरूरत क्यों पड़ रहा है, वो कारण ढूंढना पड़ेगा.
तो इफ यू आर हैविंग पीरियड क्रैम्प्स मेजरली तो हमें डॉक्टर को कंसल्ट करना चाहिए.
वो यस मैम, यस. ओके. भगवान ने किसी को भी दर्द दे के नहीं पैदा किया, किसी को दर्द नहीं दिया उसने.
दैट्स सो ब्यूटीफुल. लाइक अभी यू नो अमंग मेरे एज ग्रुप में जितने भी लोग हैं, पीरियड क्रैम्प्स इज सच अ, I would say that's such a fancy term. हर किसी लड़की को आते हैं periods हो रहे हैं, period cramps हो रहे हैं. मतलब everybody is suffering from dysmenorrhea then?
No.
They need to consult.
They need to consult.
Okay. That's such a big doubt.
No, because why will she has, I mean, some discomfort is acceptable.
But so, not the major.
No, not at all, ma'am. Not at all. Not at all. This is not something which you should take it like, I mean, if you are getting toothache, you should not take it so lightly. Whether you are not brushing your tooth very, there's some food particle is there, you have got a caries, you have got a problem in your tooth. The same way, why will you have a pain?
Just a little bit of discomfort.
Just a little bit of, because there's some secretions, there's some progesterones, the prostaglandins are there which are making your smooth muscle just to contract so that your uterus can expel your dirty blood out of your cavity and just push it in the vagina where it can trickle it out.
Okay.
Otherwise ज़्यादा नहीं, पेन तो नहीं.
सब सुन लेना ध्यान से. If you are facing pain, then you need to consult a doctor. Also, sir, there is a myth about breast cancer.
Oh, yes.
कि अगर आप रात में if you are wearing a tight bra and sleeping, तो ब्रेस्ट कैंसर के चांसेस बढ़ सकते हैं. यू शुड नॉट वेयर टाइट थिंग्स ओवर देयर. रात में टाइट चीजें पहनकर नहीं सोना चाहिए. सो इज इट ट्रू?
नो, बिग नो. Nothing related with this cancer.
Then what are the precautions we can take, to save ourselves from the breast cancer?
For that brazier thing, I would say use an appropriate size which will make you feel comfortable. This is one line. For your morning time, for your evening time, whatever it is. You should change it in the night. Use a comfortable wear to sleep. Then regarding the breast cancer, now breast cancer runs in family. If anybody in your family has a history of breast cancer, especially your mother, Masi, Nani, your maternal side, you should always talk to doctor. One. If you have a history of stomach cancer, abdominal cancer in your family, which has a component of breast cancer as well, talk to a doctor. Commonly, you don't see cancer of breast in a very young girl. It's something you can see after the age of 30 or 35. We say self breast examination is extremely important.
How do we do that?
Yes, whenever you are taking bath, after taking bath, you are coming just for the dress up, you can use your palm hand, just put it on the breast. rotate it gently. If you are finding any lump, any swelling on your feet, on your palm, consult a doctor. Second is, when you're sitting in front of the mirror, just raise your both hand and see the movement of the nipple. If both the nipples are moving simultaneously, usually you're not having much problem. So self breast examination, movements of the nipple, shape of the breast, both the breasts should be in an equal shape, is one thing which you can do. Everybody can do it at their home. If there is any discrepancy, talk to a doctor. So family history, breast discrepancies, common thing. Third thing is, breast cancer are relatively common in PCOD patients who are not breastfeeding to their kids. Breastfeeding is something protective for most of the breast cancer.
Oh.
So मम्मा का दूध बच्चे के लिए बना है. So जब बच्चा आता है उसको खूब सारा पिलाओ. ये आपको आपका हेल्थ के लिए भी अच्छा है, बच्चे का हेल्थ के लिए भी अच्छा है.
That's wonderful.
And yes, after the age of 35, whenever you are visiting a doctor, always ask them, your gynecologist. Most of the gynecologists are definitely asking about breast problem, and they are doing examination of breast. So let them check your breast at least once in a year, once in 2 years. Go to a doctor, and whenever you're visiting for anything, they'll really help you out.
Okay,
but not related with your tight
tight
braziers
bras
and all.
everything.
This is all myth.
Okay, yeah, like ये सोशल मीडिया ने एवरीथिंग पे बहुत ज्यादा ऐसी चीजें सर्कुलेट होती रहती
होता है. तो आप अपने घर के पास के डॉक्टर से मिल लो.
दैट्स द सॉल्यूशन.
मतलब फोन पे बात कर लो, ऑनलाइन कंसल्ट भी कर सकते हैं.
So we have a solution. Do not believe on all of these things. सर मार्केट में बहुत सारे vaginal cleansers अवेलेबल हैं, और they claim to maintain the pH level over there. तो वो क्या हमें यूज करने चाहिए या नहीं करने चाहिए?
Water is the best cleaning thing, cleaning stuff. You should not use water jet into the vagina, or jet which is directing towards inside the vagina, which can take वो infection को अंदर लेके जा सकता है. But cleansers once a week आप यूज करें, it's very good, because vaginal pH के हिसाब से ही वो बने हुए हैं. During your menses आप उसे every day भी यूज कर सकते हैं just to clean the private part, but they are very good for the women to be used.
Okay, there are no side effects of that?
No, you are using once a week. Otherwise, most of the time, water is the best one.
Preferable is water then. If we don't use, then also it doesn't make any difference, no?
पहले भी कहाँ यूज कर रहे थे, बट नॉर्मल साबुन यूज करने की जगह पे आप ये जो
क्लेंजर्स
जो अवेलेबल है वो आप women के लिए they are very good.
Okay.
Recommended.
Noted.